Okay, Bryce, we're live on YouTube and we shared it to Facebook. So I'm gonna get out the roll call sheet, and as soon as you're ready, I think we can start.
Okay, I'll call the meeting to order at 17:06, and Travis can do roll call.
All right, stand by here. Okay, I'm gonna start with roll call here. Jeff Beeching, Storm Trainer,
Here.
Tammy Trombley,
I'm here.
Brian Westover, Patty Bashaw,
Patty had a call. She'll be back as soon as she's done, Travis.
okay, Lisa Fish, Bryce Taylor,
Here?
Matt Watts. Looks like Matt's on.
I'm here. I'm sorry.
That's all right. John Bashaw, Robbie DeMars,
Hey, Travis, Robbie will be here in a few minutes. He wanted me to let you know.
okay, Craig Dumas,
Here.
Craig. We just heard Scott, so Scott Harwood is on. Eric Catalfamo,
I'm here.
Cap. Mickey Guy is not with us tonight. Chris Hawley,
I'm here.
Chris. James Schrammel,
I'm here.
Chief. Janine Hasenkoff, Adrian Hamilton, Paul Zinn.
I'm here.
Hey, Paul. Bruce Mason.
I'm here.
Hey, Bruce. And Dr. Bombard, who was absent. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Good. We do have a quorum, so you're good to go.
Okay, so we'll have the January 2021 meeting minutes for review. And those went out in the email, so just need a motion to accept the minutes.
I make the motion to approve.
I'll second it.
All in favor?
Hi.
Any opposed? The motion carries. Travis has the finance report.
All right. Okay. So I guess I'll go through what the current bank balances are in each of the accounts. In PayPal, there's 932.26. operations account $63,532.90. In the conference account, $74,503.70. The CON account, $50. And the education account, $4,223.19, for a total of $143,242.05 on hand in different accounts. There's currently approximately $17,661 in accounts payable, and in accounts receivable, $59,519, which is mostly education conference in New York State receivables. Vouchering has been, things have gotten better from a contract perspective in vouchering. We finally got both contracts. We have two contracts, program agency and the REMSCO with the state. Both got executed. So we're finally going to be able to voucher for REMSCO REMSCO money, Q1, Q2, Q3, and we'll be vouchering for Q3 program agency, which is a good thing. So hopefully, it seems as though we're kind of getting all the contract stuff squared away in time to start it all over again. So, we'll see how that goes. When the state was withholding 20%, I think it was 20% out of the voucher early on in the pandemic, we got that money back plus a little interest. So that's good. Just leading up to finally getting a couple vouchers paid and getting 90 some odd $1,000 from what the state owed us, we did apply for and got approved for a paycheck protection loan, which had a value of about $32,000. We're getting very close to applying for the forgiveness on that loan, which is through Glens Falls National. That really was going to be kind of a lifesaver as far as paying payroll and health insurance costs and things like that. So luckily money's come from the state. And what we're able to do with that money is basically allocate those funds to paying education stuff, so that we can use state money to pay for state related payroll and get that reimbursed in the next voucher. So that's good. So, financially compared to where we were at the last meeting, we're it's never great, right? Because we know how the cycle is and all that, but certainly a lot less stress than where we were at in January. Other than that, Vanessa, the CPA, Vanessa Perkins, is still working on our files remotely. We do have a system where still learning all aspects of the system, but where we're uploading anything related to accounts payable or accounts receivable into the system and doing approvals and processing through that. And then it'll also allow for once there's the correct approvals on a certain bill or whatever it is to process it, and then the system actually cuts a check. And then the ones that need dual authorization for a certain amount, it just requires 2 approvals. So we're starting to get that set up, which is good. Trying to think if there's really anything else that stands out, but that's kind of the gist of what's going on as far as the finances go. I'm not sure if Storm has anything to add, if there's any questions, but if not, it's the end of the report.
Storm, do you have anything to add to that?
I can unmute myself. So no, I don't have anything to add.
Okay, Travis, do I need a motion to accept or just move on to the
I
systems
don't-
committee report?
I don't think we ever have. I think we just move on to the next report.
Okay, so systems committee report.
Well, this is Jamie Schrammel. I know we've been working with Champlain EMS and Essex County. I know that they're getting their applications, getting their letters out. I don't know where they are currently in the process. I know they've been working on those 2 items to make sure they get all the stuff out and get it ready. I know it hasn't come up for a vote yet. I think Travis might be able to fill us in a little more on exactly where they are and how close they are. I know that Essex County is very, very close. I don't know how close Champlain is.
Yeah, I know Essex County is close because I believe they sent letters out. I do see Matt is on. He might be able to speak for himself and Patty. And then I don't know if Tammy or Storm can speak to where Champlain's at, but that's exactly right. We kind of have those 2 items at least in the pipeline, but nothing that's been officially received. We have been assisting them as needed. So.
Yeah, as far as Champlain, I worked with Corey early on. I know I sent you both emails, and he was reaching out for the information that we had talked about, the letters of support and the fitness and competency for all of the board members. And I don't know where he's at either with that. He's not, he and I have not had another meeting about it. And he's likely still waiting for the letters of support to come back.
So Tammy, I have not gotten a request for a letter of support from Champlain, so I'm not sure those have gone out. So I don't know if he's even sent those yet.
Okay, well, I
I
guess.
have not received anything in my office, and typically I get one.
Okay. I do know that he was reaching out to our neighboring agencies first. So again, I really don't know where he's at. I'll have to check in with him and get back to you.
As far as Essex County goes, we've sent the letters of support out. We've gotten several back. So we're almost done with the narrative part for the application, and then we'll be submitting that. So it should be relatively soon that we get the rest of it in.
Yes. So Essex County is a municipal rollover. It's got that 2-year period, and then they have to roll it over, apply for a permanent operating authority. So that will require a hearing, and then most likely it'll be between meetings. I think if executive orders from the state stay in place, we might be able to conduct that virtually using this platform. So, but we'll see. We'll keep people updated, and we have yet to see anything from Champlain, so we'll keep you updated on that front too. But I think those are the main 2 that we've been at least paying attention to. So.
Anything further from the systems committee?
No, I think that's about it.
Okay, we'll do the DOH Bureau of EMS staff report. I know that both Joe and Mary are on the call, so whichever one of you would like to go first.
You can let ladies go first if you want.
Mary, if you're ready.
Yeah, I really don't have anything. Just when you're sending paperwork, please send it electronically to both Joe and I. We're still working remotely. And pay attention to expiration dates, please. That's it for me.
Yeah, basically, I keep harping on it, but it's going to be very important in the not too distant future. All agencies need to have a health commerce system account. We're asking that when you submit your renewal applications, that it goes through the health system account. And then you break out the agency renewal, the controlled substance renewal, and in most cases, the controlled substance report. It makes it a lot simpler for us to process the applications. The other thing that's very important for people in the BLS-FR realm is that if they intend on, we know if they intend on billing for CME, they have to go through the paper portal or the PCR portal, one or the other. The other thing that they have to understand is if they are not current, if somebody submits for CME paperwork, it's going to be rejected. They've already rejected a significant number of people whose agencies haven't bothered to update. If there's a question as when that BLSL update is done, they can just send me an email and I'll be more than happy to check it for them. But a lot of them are significantly out of date. So other than that, there's not much more I have. If there's any questions, I'd be more than happy to take them.
Thanks, Marion. Joe, does anybody have any questions about the staff report? All right, Zach, if you want to talk to us about data and informatics, please.
Yeah, so I ran a couple different reports. I ran 2020 data, and I also ran 2021 for January through March. I'll email that out to you guys. I didn't get it to Travis in time for the meeting materials, but I'll email that out. I ran the reports, same reports by region, and then I also broke them out by county. So it's interesting to see the different areas, even the different software providers, what they're actually, what the providers are actually picking for options with those different providers for different medications and procedures. So take a look at those when you get a chance. You know, one of the big ones, some like the Narcan options, you can see they're kind of broken out. Even some of the different albuterol options, and along with the oxygen too, that's a good one, where there's a couple different options for that medication. So, you know, we have different agencies using different options, even though really it's the same medication. So that's kind of skewing some of the results. Same with some of the destination names. They're a little funky. So I'll send those reports out to everybody so you guys can all take a look at them. Other than that, not a whole lot. A lot of agencies have been switching to either the paper PCR portal or to one of the electronic PCR options, either from the state or we've actually had a lot of people signing on with an actual fee for use software. It's a pretty good mix between the two. As of the beginning of this month, we've had 16 agencies that have converted to some form of electronic PCR or to that paper PCR portal from the paper PCRs. We have 7 more agencies that are already scheduled to transition before July 1st. So any agency that's currently documenting on paper PCRs, they have to, at the very least, switch to the paper PCR portal to submit those PCRs, and they have to do that by July 1st. So we still have a bunch of agencies that have not done that. So if your agency needs help with that, or you know some agencies that need help with that, reach out to me or have them reach out to me, and I can send them some info. We can set up a Zoom, do a training, you know, whatever. Clayton County's done really good. We've gotten, I think, pretty much almost all of their agencies to the point where they're ready to switch or have already switched before that July deadline. So that's really good. Other than that, not a whole lot. I'll be sending out some other reports to agencies monthly. It's kind of building the reports. once I get them built, then it's easy to just change dates and run them. So, you know, if your agency has anything specific that you're trying to look at or study, let me know, and I can get some reports going for you guys. I think that's about all I have, unless anybody has any questions on anything.
Any questions for Zach? All right, we'll go ahead and move on to education reports. Travis, if you'd like to start.
Sure. So we have several courses running in the region. Once again, I mentioned it last time, but the instructors have done a really phenomenal job just kind of dealing with all of the COVID twists and turns, and just dealing with everything that comes with that and teaching through all this. So we haven't slowed down as far as courses go. I mean, we've pivoted some here and there, and we've used Zoom and whatnot, but things have chugged along. So we have several courses that are running in EMT in Essex County, and EMT in Franklin County, EMT in Granville, which is just finishing up, and AEMT in Granville. That's in Washington County. And then we do have some courses that are kind of coming up, an EMT, a daytime EMT in Queensbury, which is an annual thing for us. We always get a huge response. We've got about 30 registered for that. We had to shut it off and start a wait list for people. We are just finishing up some core content stuff that that was a collaborative effort with Elizabethtown Community Hospital Paramedic Program. They were going to do an online, well, I shouldn't say online, a hybrid paramedic refresher course, and we kind of worked with them to throw out some core content courses as well, some critical care and paramedic core content courses. Not a huge response, but we did have a few people sign up for that. So that's just finishing up. And then I didn't mention it in the REMAC meeting, but we did receive from their holiday match grant program, we received some funds from Stewart's to purchase some pediatric restraint equipment that we can use for training purposes. So that was good. We received that check a few weeks ago. And did mention this earlier, the group that we've been working with for a few years on some leadership initiatives. It includes REMO and Wilton EMS and E5 support services and the Hudson Mohawk AHAC and Cambridge Valley Rescue Squad, Delmar Bethlehem EMS. We've, over the past few years, we've done several things. We've brought in people and we've done seminars and we've done some online webinar stuff. But our latest project is this Board of Directors podcast. And so it's really just meant for not just people who are members of board of directors or, leaders at a nonprofit type agency, but anybody in those agencies who want a better understanding of how to, manage an agency when it comes to everything from finances to personnel to planning and all those different things. So we've done 2 episodes. Both of those have been streamed to Facebook. You can go watch those videos on Facebook. You can also go to our website and listen to the podcast episodes, the finished episodes on the website. And they're going to be available on Apple and Google podcasts as well. So you can download those and take a listen and pass them on to your agencies, and maybe they can get them in the hands of their boards, and maybe we can help some of these agencies that might be struggling a little bit, as well as agencies that are doing a little bit better, but their board members are willing to kind of broaden their horizons and improve. So that's a fun project. And then next week, we've got the initial assessment conference, which is in Glens Falls this year. We had a good response, actually shut off registration at noon today. And we limited capacity, came up with a plan that was approved by the county and in consultation with the state and the city. And a plan that involves mask use. And the exciting part is 95 or 96% of the attendees are vaccinated, and we're incorporating on-site testing as well, which is being done by Cambridge Valley Rescue Squad. Cambridge Valley went through the process with Wadsworth and have partnered with their county and the state to do testing, and thankfully they've agreed to help us out with that. So we're looking forward to a good week next week, getting people back in the classroom. Most importantly, kind of getting their hands on things, everything from airway equipment to cadavers and everything in between. So that'll be really good. If anybody's around and you haven't registered, or if you haven't signed up, feel free to pop in as REMSCO members and see everybody. That is, I believe that's it for education, Bryce. I'm just realizing that I don't think I sent this link to Bruce, so I don't know if Bruce Berry's on or not.
I see a Bruce. I don't know if it is Bruce Berry or not.
I think it's Bruce Mason. That's my fault. I forget to. Bruce used to be on the REMSCO, and so he used to be on the email list for the REMSCO, and I'm going to have to add him back on because this is like the second meeting in a row I forgot to send him the Zoom link. So that's my fault.
Okay, Scott, if you want to talk about Alice Hyde.
Yep, absolutely. Alice Hyde plans on doing their normal fall course, and they're getting ready for that. So back to normal operations.
Awesome. And Storm, if you want to talk about Clinton.
Unmute myself. Hang on 1 second. Let me shut off my pager because God forbid I can find it. So our Clinton County is finishing up their spring courses. We're finishing up the AMT, and they all end the end of May. And then we are going to do try and do a very aggressive basic course this summer. People have expressed an interest, and I've had a lot of phone calls on it, but I don't know what the registration looks like at this point. It starts on June 29th, and it will go to, I think it's the first week in August, so it's going to be rather quick. And then we will start our usual fall courses, both basic and AMT in the fall. So that's where we are. We're continuing to have PALS and ACLS classes regularly. I alternate usually every month so that we can capture everybody and make sure that everybody stays certified, since that was the mandate. We're concentrating on PALS this year, since we concentrated on ACLS last year and we'd extended PALS certification till this year. So hopefully everybody will get finished up in time for the end of the year. And that's where we are.
Thanks, Storm. Any questions regarding the education reports? Okay, let's do the county EMS coordinator reports, and we'll go ahead and have Storm start that off.
I truly do not have anything significant to report. We are still, of course, doing some COVID stuff, not anywhere near like we were. We are still having regular meetings and still doing, so we're assisting. A lot of people are working at the state pod. A lot of the EMTs are working there. Since we have a state pod site here on the airbase. And that's working out very well. Morrisonville is manning their medical transport teams, or there are medical teams that are taking care of patients who have reactions post-vaccine, which we haven't had a lot of, but we have had some that have gotten transported to the hospital. And that's pretty much it. We're just kind of trying to keep a level head till we're done and get our people vaccinated. Everybody.
Thank you, Storm. Scott, if you'd like to go ahead.
Yep, thanks, Bryce. So we're hanging in there as well. We have more of a volunteer component than the other counties, so we've definitely seen a little impact with the COVID conditions. We have a lot of active projects moving to paid agencies and paid staff, and quite a few. And you'll be seeing a couple of those projects at the next meeting. So we look forward to presenting those. Thanks.
Thank you. Bruce Mason, if you'd like to go.
Sure. Very little in Washington County. Basically, it's just business as usual. Mark Spezio's group out of Cambridge Valley spearheads this, the inoculation group. I know they were doing some homebound cases, and I know they still help out the public health at their sites. So I don't know. We're still doing the meetings for the future of EMS in the county. Nothing definitive. So at this point, I think I haven't got anything to say. Thank you.
Thank you. I know Mickey isn't here. Is there anybody that can speak on her behalf? And
yeah, I don't think there's anything earth-shattering going on in Warren County, with the exception Bruce touched on EMS agencies and EMS agencies vaccinating and stepping up, and Storm mentioned up there at the Plattsburgh vac site, EMS providers have been stepping up. I don't know. I think EMS is proving its value in a lot of ways lately. And Warren County, a handful of agencies have done the same. West Glens Falls EMS and Glens Falls Fire and Bolton EMS in particular have stepped up and became applied for this new kind of New York State community paramedicine thing, and they've been doing homebound vaccinations, and they've been working at the state site here in Queensbury. So that's the bulk of what's going on in Warren County. We're getting ready to prep for summer and fall events. Host a lot of events in Warren County, but I can't think of anything else that she'd be telling you right now. So that's all I got.
thanks, Travis. I don't see Patty back yet. Matt, do you have anything to speak on for the county?
Sure. As stated earlier, we're getting close to doing our CON, finalizing that and sending it in for turning our municipal temporary one into a permanent one. We just started with E-Town Lewis and Westport EMS with staffing, filling staffing needs during the week. I think they're going to probably be, at this point, the last agency that we assist with the staffing needs for now. We're now in like 6 different stations covering that. We got an EMT class going on, the paramedic class going on. That's about it that I can think of. We're assisting with the other thing is we're doing a lot of COVID pods with the public health. We're doing a lot of assisting with those, both administratively and actually they're doing stuff with them. That's all I got.
Awesome. Thank you, Matt. Does anybody have any question about the coordinator reports? Okay, Travis, if you would like to give the REMAC report and the forwarded motions.
Sure. Let me pull up the appropriate list here. Okay, so the REMAC met earlier today at 2 p.m. There's a forwarded motion to approve North Warren EMS, Empire Ambulance, Cambridge Valley Rescue Squad, Rouse's Point Fire Department, Salem Rescue Squad, Fort Ann Rescue Squad, Ticonderoga EMS, and Morrisonville EMS for a 2-year renewal of their Advanced Life Support Operating Authority.
Can I get a motion to accept the forwarded motions from the REMAC?
Also North Country Life Flight.
Oh, good call. North Country Life Flight. You know why? I pulled up the wrong list. But good call. Add in North Country Life Flight to that.
Okay. I saw Matt Watts for a motion to accept. Can I have a second?
I will second it.
Thank you. Any or all in favor? Any opposed? The motion carries. And then I believe we have a forwarded motion for a BLS CPAP agency.
Correct. For Fort Edward Rescue Squad, BLS CPAP.
Can I have a motion to accept the forwarded motion for the BLS CPAP agency?
Motion.
And a second? Thank you, Chris. All in favor? Any opposed? That motion carries.
And other than that, it was the usual reports. We did talk extensively about transport and destination decisions in the field. Most people are probably on the call, but the discussion was surrounded transport decisions to facilities and what facility capabilities are across the region. It's the largest issue seems to be in the Tri-Lakes area with the Lake Placid kind of freestanding ED there, and what should go there versus AMC versus a trauma center or a stroke center, or if maybe it's cardiac and the closest cath lab is CVPH, and all those different types of conversations. And it seems as though there's maybe some decision making going on behind the scenes, and it's not based on what's always right for the patient, or we're not maybe giving the all of the information to providers and agencies and allowing them to function as clinicians and make decisions sometimes on their own or in consultation with med control. So again, a wide kind of ranging discussion on that, but what the body decided to do was form this little committee, initially comprised of Bryce Taylor, and think of it this way, I guess Bryce sort of representing the REMSCO, Dr. Bombard, REMAC chair, representing the REMAC, and then Aaron Barney was on, local paramedic there in the Tri-Lakes area, and he is willing to volunteer to kind of look at this and maybe see if those three can kind of come up with some thoughts and ideas before expanding the group, and see if we can get people some guidance and some accurate information on what the capabilities are at each facility, and how we can kind of move forward. So I think that was the only other big piece of information coming out of the REMAC meeting.
And do we need a motion to form that committee or anything, Travis? Is that operational stuff?
I don't, I thought about that after the fact, but I don't think so. I think it's in the minutes, and everybody was in agreement that they should take a look at it. So I think you're probably good there.
Okay. Any questions or discussion regarding the REMAC report? I cannot see the agenda, so let's go ahead and move on to old business, which is COVID-19 operations. And Travis?
Yeah, not much to report. Operationally here at the office, it's about the same. I'm typically here, every day unless I'm out on the road someplace. But Zach is coming down twice a week. He's kind of got this hybrid um, work situation going on. Trying still to kind of be careful and limit how many people are here. But for the most part, operations are pretty normal, and that's just from the organizational standpoint. We're still supporting agencies the best we can. We still have viral filters. There's not as big of a need as there was last spring, because PPE and things are more readily available. So, um, you know, we're trying to be supportive in that regard. We have given some agencies, um, you know, um, some PPE and the viral filters that we acquired last year. So, other than that, we talked at the REMAC meeting briefly about um, rules, and we talked about how the CDC has kind of maybe come out with a little bit of stuff about people who are vaccinated and being around other vaccinated people. That hasn't necessarily trickled through the state level, and so um, any policies or guidance that was put out by the state previously prior to vaccinations still stands. That's the consensus right now. So even if there's two people working together on a crew and they've both been vaccinated, um, until we receive anything different and we can disseminate that from the state, they should be masked if they can't distance. So that'd be in the cab of the ambulance or the station, things like that. Um, I'm sure things are going to be updated, relatively soon, especially with more vaccinations going out and the CDC kind of constantly, updating things on their end. So I've gotten a lot of inquiries about that. Um, I'm seeing, a lot of people kind of doing what they want anyway. Um, some providers not protecting themselves completely when they're flowing oxygen or doing different things. You kind of get sick of it after a while, mentioning it and trying to police it a little bit. But yeah, we're just we're encouraging people to kind of just stay the course, be patient, let the guidance come out, and you know let things take its course. So that's it, COVID wise.
Thank you, Travis. Any questions or comments regarding old business? Okay, we'll move into new business. First off, the Washington County seat determined January 31st. And I believe Travis mentioned that they do not have anybody put forward for that position yet.
So Washington County is the one that we do have somebody put forth, which is Vicki Campbell, and her letters and resume and stuff was in the meeting packet. So if the body so chooses, they could act on that. The Warren County seat, which expired, Jamie Schrammel's second term expires or ends on 4/30. There's a few days away, and there is not yet somebody put forth for that seat. So his term will extend until that seat is filled, unless he resigns. But hopefully the chief will stick it out until the next meeting in July, and I'll push the Warren County people to get somebody put forth for that seat.
Okay, any discussion for Vicki Campbell's nomination for the Washington County seat? Okay, I need a motion to accept Vicki Campbell for the Washington County seat.
I make the motion to accept.
All in favor? Any opposed? The motion carries. Do we need a motion to keep Jamie Schrammel as the chair until we have a replacement put forth for the next meeting, Travis?
I don't believe so because I think it's spelt out well in the bylaws. So I think you're okay there.
Okay, and I believe the next thing is we need to put forth 2 members with letters and resumes for the CMAC to pick as the representative for us. Is that correct, Travis?
Yeah. So they require us to put forth 2 options. So we really need to get this done because 1, it takes forever to get these people vetted, but 2, Patty is at her term limit, so we need to put forth two choices basically to the state. So I don't know if Bryce, you want to take maybe sort of nominations from the floor, or if anybody wants to speak up if they want to do it. We'll have to start somewhere, I guess.
Would anybody like to put themselves forward to become the next CMAC representative?
So Travis, I can go back as probably because I've been vetted in the past, it might be easier to get me vetted quickly. Maybe, I don't know. We could try.
Yeah, that I don't know. You
But I'm willing to do that. And then if there was somebody for backup, because my plan is to only be around for another 3.5 years. And then my hope is to retire, truly retire at this time.
And just one point of clarification, Bryce, I put on the agenda CMAC. It's actually SEMSCO representative.
Thank you.
So,
I saw the correction.
So as long as the SEMSCO bylaws allow for, I don't know if you had to be off by a certain amount.
Yeah, you have to be off for a year.
But
You have to
okay,
be
so
off
that
for-
would be one, and then we have to put forth a second name, and then I guess somebody chooses. I don't know if it's the commissioner's team or how it works, but we have to put forth 2. So who's the second one?
Travis, I don't mind.
Who was that? Tammy?
Yeah.
Tammy.
Okay. So Storm and Tammy, could you send me your updated resumes and kind of a letter of interest, so to speak?
Yep.
Awesome. I'll get that down to Val at the state, and they can. I think Patty continues until it's filled, right? Is that correct, Storm? Or until somebody's vetted, or does it just stay open?
I don't remember. I'm going to say that we didn't run into this with mine because we had Patty filled in for me. So I don't know. I don't know what the answer to that is. I'd have to look it up.
No problem. Well, we'll send it into Val.
We'll send it in, she'll figure it out.
Yeah, I mean, it's been taking forever, and I mean forever to
get people vetted.
So we'll see what happens. But
yeah.
Okay. You should probably vote on that, though. You should my opinion is you probably want to vote on that.
Okay, I need a motion to nominate Storm and Tammy as our SEMSCO representative candidates. I got one from Matt, and I need a second. Thank you, Chris. All in favor? Any opposed? And that motion carries.
Okay, so I'll collect their stuff, and then I'll get a letter typed up that Mickey can sign. We'll get that sent into Val.
Awesome. Thank you, Travis. Any other questions or concerns with the new business? And then any public comments or questions? Travis, do you see anything on the YouTube stream?
Let me take a look here. I don't see anything. Yeah, I don't see anything.
Okay, thanks, Travis.
Yep.
I need a motion to adjourn the meeting. I
I'll
have
make
a
a
motion.
motion to adjourn.
I have a motion from Storm and a second.
Sure.
All in favor? Any opposed? And the meeting's adjourned at 17:57. Thanks, everybody.
Thanks.